Coronavirus is a problem everywhere. It is a problem not only in our free communities, but also behind bars in the prisons and jails that are all over the United States. Cook County Jail in Chicago is the nation's largest known source of coronavirus infections, with over 350 cases. There's Rikers Island in New York, where many people have not been convicted of a crime, but are rather awaiting trial. And it saw its first inmate die this week from the virus. At least 287 inmates and 440 staff have tested positive just at that facility alone. Responding to the crisis, many governors are expediting the release of certain categories of inmates. Many advocates say, though, this is a much larger problem, and that includes our next guest. Piper Kerman is the best-selling author of Orange is the New Black. She spent 13 months in a federal correctional facility. Kerman also penning an article in the Washington Post noting that prisons are uncontrollable super spreaders if you don't take the right precautions. Her work is known to so many as well from the adaptation of her book, Orange is the New Black. Thanks for joining me.
Of course, Ari. It's great to be here with you.
So what is it that people need to know about this as a public health issue first, regardless of how they may feel about inmate populations, and then second, as a humanitarian issue, because people who are behind bars still have full human rights?
So people need to know that pretty all American prisons and jails are vastly overcrowded, and that social distancing and all of the practices that we've adopted nationwide to try to fight this pandemic are impossible behind bars. So as an example, I taught at a men's medium security prison in Marion, Ohio, which is the first prison to have an outbreak there. That prison was built for 1,400 prisoners, and it currently holds 2,600 men. So that's how overcrowded most prisons and jails are. And those conditions make it impossible to slow the spread. So people may be indifferent to the conditions that the people who work and the people who are incarcerated there, are enduring. But what they need to know is that there's no way to keep those hot spots behind the walls of a prison or a jail. And Cook County Jail is a great example. Prisons and jails are connected to more than 1,300 cases across the country. And those cases are not all behind bars. Those are also staff. As you mentioned, a number of correctional officers have tragically died, and their families. And as we know, this pandemic spreads really quickly. It's highly contagious, and the presence of an outbreak behind bars threatens the outside community. The only way to combat those outbreaks is to reduce the populations in those prisons and jails. So we've seen that happen in many municipalities. So some county jails or city jails have done a good job of reducing their populations swiftly. And that wasn't hard to do because there were a lot of people who were there for very low-level misdemeanors, or they were there eligible for bail and just sitting there because they were too poor to pay their bail. So some places have done a good job of getting those folks out of confinement and, flattening the curve. Some prisons and jails have not. Some prisons have not done a good job at all. We've seen much more trouble in the state prison systems in terms of getting governors to do what they need to do to protect public health.
I want to play in that vein something from an Ohio prison, which I know you know about, you taught there, where we're going to hear a prisoner describing some of these conditions and challenges right now.
Right.
Somebody in here tested positive for that COVID-19. It's a few staff members who got it, but somebody in the inmate population got it now, so this is what they gave us. Like all the necessary precautions are out the window. There's a few dudes in here right now who got fevers, who they not testing and not taking out of here. It's pandemonium in the pandemic. But essential things like hygiene, toothpaste, soap, deodorant, all that stuff is about to be non-existent here in a second, and they don't got no way of getting us no more.
What should be done about this?
So that footage is from Marion Correctional Institution, where I used to teach in Ohio. And so this is a men's medium security prison. It happens to be the prison that holds the largest number of elderly prisoners in the state of Ohio. It is way over capacity. Again, built for 1,400 men, holding about 2,600. I can tell you, I had a lot of guys in my class there. I'm thinking about my students. I'm thinking specifically about, some of my students who I know are very close to release. So a couple of guys who have been incarcerated for, let's say 8 or 9 years, but they are within a year of their release. They are more than ready to go home. And so there are a lot of people in state prisons who are close to their release dates who should be released now, if they have a safe release plan, in order to reduce that population. And the other group of people in state prisons who must be fast-tracked for release are those elderly prisoners and critically ill prisoners. And again, Marion Correctional Institution, the first outbreak in Ohio, the other really bad outbreak in Ohio is at a federal prison, holds more elderly prisoners than any other prison in the state of Ohio. And this is a problem across the country where the number of elderly prisoners across the country has grown by 300% over the last 15 years. So there is a significant percentage of prisoners in all American prisons who are among the people who are most at risk. And they're also the lowest safety risk. Elderly prisoners have extremely low recidivism rates. So sending those people home as an act of mercy is not a threat to public safety, but not sending them home is a threat to public health.
Right, and it goes to the balancing that we do and whether any of that needs to be rebalanced. Lord knows Americans are rebalancing a lot of their daily lives, policy, economy, losing jobs. What you have, I think, emphasized tonight and in your work is there are trade-offs in the prison system already that are very questionable when you talk about what is the value to to society of keeping someone who's 70 years old incarcerated so they die in there depending on the offense? And does any of that need to be rebalanced right now? I think these are profound questions. I appreciate you raising them, Piper Kerman.
Sure.
Go ahead. You have one more thought? Did you have one more thing?
Oh, I would only say that, we've seen, governors like Governor Cuomo, Governor Newsom, Governor DeWine in Ohio do lots of smart, important, and swift things to protect the people in their state. But where all three of those governors are falling short is around this question of public health and public safety when it comes to the state prisons. So tragically, in Ohio, yesterday they reported their first death of a correctional officer, and that
we have
governor, that is Officer Dawson, and
John Dawson.
I saw him every day when I would leave the prison, and he was close to retirement, and he was a good guy. He was a nice man, and that was an avoidable death. And many of these deaths are going to be avoidable.
Yeah,
So
Piper, again, I have to fit in.
Responsibility to do the right.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.